Welcome to MSK Ultrasound Shorts. In today's video, we are going to discuss an uncommon presentation of a common musculoskeletal pathology. This is a 52-year-old female who presented with complaints of pain and swelling over the lateral aspect of left thigh, which she noticed since few months. But the reason why she consulted clinician was she developed a discharging sinus tract over the anterior aspect of left thigh with discharge of some serosanguinous fluid and even few calcifications. On probing, she gave history of blunt trauma in a road traffic accident. There was no history of fracture, no history of any interventions or injections done in the past. This is a video clip. We can see a fairly defined heterogeneous hypoechoic complex fluid collection along the anterolateral aspect of thigh. Carefully look at the location of this collection. This is skin, subacute fat layer. This is the collection. This is the deep fascia. That's the muscle layer consisting of vastus group of muscles, and deep down, this is the echogenic line of bone. So, this collection appears to be located deep to the subcutaneous fat layer and superficial to the fascia. As I am scanning this collection, we can very well see the muscle layers of vastus group of muscle deep to it, and this collection is opening via sinus tract onto the skin, and there are some echogenic calcifications seen within. This is a high-resolution panoramic ultrasound image which nicely depicts the extent and location of this collection. It is located deep to the subacute fat, superficial to the fascia, and it is forming an obtuse angle with the fascia. We can see a sinus tract with few calcifications and some minimal vascularity was seen within it. So what is the diagnosis? Is it a soft tissue degloving injury? Is it a muscle injury with hematoma or abscess or a chronic subcutaneous hematoma? So the diagnosis is very obvious. It is soft tissue degloving injury, also called as Morel Lavallee Lesion, named after French surgeon Morel Lavallee in 1853. So what is this Morel Lavallee lesion? For that, we need to go into the depths of anatomy of the parietal layer. We have skin on the top, subcutaneous fat, superficial fascia, deep fascia, muscle layer and bone. Deep fascia further goes down and encircles the individual muscles in the form of intermuscular fascia as well. And we have the blood vessels and lymphatics which traverse across this fascia towards the skin and subcutaneous fat. So, when there is a high velocity shearing force, skin, subcutaneous fat and superficial fascia together form a unit and separate out or shear out from deep fascia, muscle and bone. As a result, there is a serohematic fluid collection between the superficial fascia and deep fascia, and this serohematic fluid collection is called as Morel Lavallee lesion. It is known to occur at very specific locations, particularly in the thigh near the anterior superior iliac spine, hip, pelvic regions, but can also occur in other areas as well. It may be associated with trauma such as pelvic fractures, hip fractures, other injuries in the lower extremity. It may undergo complications such as infections, pseudocyst formation, skin necrosis, or chronic persistence. Treatment is usually conservative, consisting of compressive bandages, percutaneous drainage, or sclerodesis to promote the fibrosis or closure. Surgical interventions are generally restricted in complicated cases which are not responding to conservative management and include open debridement and irrigation, minimally invasive techniques such as video-assisted endoscopic debridement, Skin flaps and grafts are generally needed for severe cases to address the skin breakdown and to restore the skin integrity, and radical surgery is reserved only in rare cases. Thank you.